Question is to the Minister for Health and Aged Care. Will the Minister please advise the House on how the Morrison government is supporting the health security of all Australians by investing in vaccines and treatments for COVID-19 while continuing to invest in medicines, including those that assist Australians with a diagnosis of prostate cancer?
The Minister for Health and Aged Care has the call.
Thank you very much, Mr Speaker, and congratulations. To the member for Barker, I particularly want to acknowledge his work in supporting the mental health of people in rural Australia during the course of the pandemic. And one of our great national health security achievements has been to see that in 2020, when many expected a tragedy on a terrible scale, the rate of suicide in Australia went down. There's more to do, but it's one of our great achievements together as a chamber, as a parliament, as a government, as a nation. Another great thing is that we now have one of the lowest rates of loss of life to COVID in the world, at the same time having one of the highest rates of vaccination and the strongest economic recoveries in the world. In particular, we have now, through this vaccination program, passed the vaccination averages for first doses of the EU, the G7, the OECD, the United States, Israel, the United Kingdom, Germany and now France. All of these things are saving lives and protecting lives at a time when there have been 600,000 cases worldwide in one day, 7,000 lives lost in one day worldwide. So the vaccination rate of 91.8% for first dose and 85.8% for second dose is protecting Australians. But at the same time, we're also investing in treatments. Ronapreve, to make sure, along with Sotrovimab, that we have hospital infusions that are already protecting and treating Australians and bringing down the loss of life, even for those that are in hospital at this point in time. Critical treatments, Molnupiravir, where we've acquired 300,000 units, the Pfizer protease inhibitor with 500,000 units. All of these things are saving lives and protecting lives now and in the future as those new treatments are approved and therefore made available. At the same time, what we've also been doing is continuing our work in the listing of new medicines under the Pharmaceutical Benefits Scheme. This program, which has been a staple of Australia's health condition with one issue in 2011, is fundamental to the protection of Australians. On the 1st of November, at the start of November, we were able to list a new medicine for prostate cancer, Nubeqa. Nubeqa is going to help 1,000 Australian men save $40,000 a year, but much more importantly than the money saved, give them access to a life-changing, life-improving and in some cases life-saving treatment. Vaccines, COVID treatments, treatments for prostate cancer, treatments for numerous conditions. These are the things that are saving lives.
Order.